Our project is on brachial plexus injuries tackling.
Starring Jesse Layton as Ginger. John Hickey as Coach Jerry Harry. Audrey Owen as the Tackling Fairy. Derek Nesbitt as Melvin. The brachial plexus is a large thoracic nerve that feeds to three smaller nerves that in turn innervate the arm. The brachial plexus originates from cervical nerves C5, 6, 7, 8, and thoracic nerve 1. The roots of the brachial plexus pass through the gap between the anterior and mid-scalene muscle, along with the subclavian artery.
An injury can happen when the glenohumeral joint is forced down as the head is forced up and away, or by compressing the clavicle down onto the brachial plexus, pinching it. Brachial plexus injuries, also known as burners or stingers, are the most common peripheral nerve injuries seen in athletes. 7.2% of all football injuries were brachial plexus injuries, and up to 70% of college football players have experienced a stinger by the end of their college career. A common scenario of a brachial plexus injury is when an athlete's head is forced to the opposite side while going in to make a tackle or block during football. This causes nerve compression because of neck hyperextension and ipsilateral rotation. Another scenario is direct impact to the erb point, causing compression to the brachial plexus, and is often associated with poor-fitting shoulder pads. To prevent stingers or burners, the use of proper equipment, good technique, and neck strengthening exercises can make an athlete less likely to get these injuries. For football players, spearing, which is attempting to make a tackle while leading with the crown of the head, and poor form tackling should be avoided. Shoulder pads must be fitted properly. Additional equipment such as a soft neck roll or a cowboy collar may help prevent stingers by keeping the nerves from being stretched. Finally, players with recurrent stringers may benefit from physical therapy focusing on neck, shoulder, and back stretching and strengthening. No athlete should return to activity until the initial symptoms have resolved and arm strength has completely returned. If symptoms are very brief and arm strength is normal, athletes can often return to competition very quickly. However, if symptoms persist, as they do in 5 to 10% of cases, the athlete will need further evaluation prior to returning to their sport. Players suffering from recurrent stingers may benefit from the aforementioned cowboy collar. Treatment for brachial plexus injuries will depend on the type and severity of your injury. Treatment options may include initial watch and wait. Some milder injuries will improve over several months, so your doctor may schedule regular appointments for 3 to 6 months to monitor your progress. Therapy is also an option. Even if your injury heals on its own, physical and occupational therapy are typically recommended to help you regain full function. There is also the option of surgery. If there is no improvement within 3 to 6 months or the injury is severe, surgery will be needed to improve nerve function. Some surgical methods include neurolysis, nerve graft, nerve transfer, free muscle transfer, capsule release, tendon transfer, and joint fusion.
Today, we were playing football.
Oh, Christ, not football! I love football.
We know, Ginger.
I know. Put me in, coach.
But you don't know how to tackle, Melvin.
Aw, shucks. Give me a shot.
All right, Melvin.
Oh, my brachial plexus.
Instant replay!
Oh no, my brachial plexus.
on the opposing player's body when making a good tackle. Of course, the first thing we got to do always when we make a good tackle is starts with a good base. You want to get your butt under yourself and have that good base. Then when you're ready to explode into the player, you have to make sure and wrap up in the proper spot. You never want to come up and hit a player up high. For one, if they're a big running back like this guy is, they're just going to hit you, they're going to shed you, and you're not going to be able to make the tackle. Also, this is a hard place to wrap up around in here. It's so much easier to wrap up around the waist or around the legs. You want to make sure and put your outside shoulder into the player that you're wrapping up. You never want to take your head and lead in with your head. First of all, you're going to cause injuries. Secondly, you can pick up penalties for spiking in to the center of a person's chest. So you always want to place your head to the outside and get that shoulder. You want to wrap up down low, and then you're going to drive through the tackle, and that's the proper way that you place your body on the opposing player when making a tackle.
Thanks, Tackling Fairy. Give me another shot, Coach.
All right, here we go.
Ah!
Oh, Melvin! I never knew.
Thank you for tolerating our video.